So thank you all for coming today. My name is Danielle Griffin. I'm a marketing manager at Taylor & Francis Group. I oversee the North America Books Library marketing team. This is my third time attending Charleston, and I'm excited to have my first speaking opportunity today with you all virtually. The discussion today will center around the strategic solutions that libraries, publishers, and vendors are using to support academic communities in response to the COVID-19 pandemic. In mid-March, as the spread of the COVID-19 around the world continued, Taylor & Francis adapted in an effort to remain committed to support our customers as they increasingly move to remote learning and instruction. How did we support our customers? We supported our customers through providing free access to vital research. We created a microsite on COVID-19 and infectious disease content that had journal articles and book chapters. Our F1000 research division created a dedicated gateway to showcase research published in this area, and we prioritized the rapid publication of COVID-19 materials. To support remote learning, in April, we partnered with RedShelf, VitalSource, and Cortex to grant free ebook access to students and faculty who had left books on campus and were unable to get them because of campus closures. And at the same time, we made 10 of our top online and distance learning books free to view so faculty had access to the full text of these books at no charge. We hosted a webinar with Susan Coe, the author of Teaching Online, that focused on practical tips and strategies that would be helpful for instructors transitioning to online teaching for the first time. We worked to create additional materials to support instructors teaching online for the fall semester. And in response to a surge of last-minute e-inspection copy requests, we looked at adapting our internal processes in order to work through those requests more quickly. And as we move forward, we continue to evaluate how we can provide our customers with the usual range of services while also creating additional materials to help support them while they face new and unprecedented challenges. We've pivoted our content strategy to focus primarily on resources that are specific to online teaching and fit with what challenges faculty are encountering. Through working with our ad partners, we've adapted existing plans to create a forum for librarians to come together to collaborate and brainstorm on challenges as a result of the COVID-19 pandemic. We created the socially distanced library, facilitating the transition to online services and instruction webinar series with our partner Choice and with today's presenters, Ron Leonard and Dr. Phill Johnson, to discuss a range of topics, including the leadership perspective, a case study of the Alabama library system in Auburn University, transitioning faculty to online teaching environments, physical spaces, transition tactics, and a look at data. Shortly, we will be launching the Socially Distanced Library podcast this November. And we continue to look at how our participation at conferences will take place as we move into 2021, while we chose to attend virtually this year. We continue to expand our partnerships and look for ways to develop them, opportunities to partner with libraries in ways that we have not previously supported them, opportunities to pilot different purchasing models, and how can we partner with bookstores on campus. We continue to explore potential interest for new products and digital resources. In closing, Taylor & Francis continues to work to explore how we can further develop our partnerships and exploring ways we can get involved to support topics on current industry challenges. So I encourage you to continue to have conversations and explore new ideas and develop mutually beneficial relationships. In the meantime, please don't hesitate to reach out to me, and thank you for your time. Now over to you, Ron.
Thanks, Danielle. In the spring of 2020, it was business as usual for the Alabama Virtual Library, or commonly referred to as AVL. We had some one-time funding, so we were setting up trials of several different resources, and simultaneously, some of our board members were preparing to speak during an affordable learning conference that my organization was hosting, because the ABL is the state's OER repository. And then overnight, everyone started canceling. So we had to cancel the conference. And then shortly thereafter, our institution started transitioning from mostly face-to-face interaction to virtual learning. Shortly thereafter, I was keeping close tabs on what was going on internationally and nationally. And I was following the ICOLP listserv, and I was seeing how companies like Taylor & Francis and EBSCO were bending over backwards to make their resources more readily available to both educators and students. So this was really kind of an impetus for me to reach out to our existing vendors and the vendors that we had trials set up for of these other products to make more resources available to all of Alabama's lifelong learners. Otherwise, it was an impetus to pivot during the pandemic. And there were a few things at play that really facilitated this quick transition to provide just-in-time resources, which I'll tell you more about momentarily. But let me give you a little background information first. The Alabama Virtual Library, the AVL, is a state of Alabama entity, and as such, it gets all of its funding from the state. Therefore, we make all the resources freely available to everyone in the state. It is a little bit different from most virtual libraries insofar as the majority of the work is done by volunteers. We do pay the Alabama Supercomputer Authority to run the website, but the rest of the work is done by volunteers like Phill and me. For example, for the last 10 years, I have provided database licensing services free of charge to the ABL. Now, over those 10 years, I've built up a good rapport with contacts at a lot of different businesses. They'll ask me for favors, I ask them for favors in return. So there was a good working relationship going into this. Then on top of that, we had 2 or 3 precedents of reaching out to vendors in times of need, for example, following the Gulf oil spill, to make more resources available. So we took advantage of the situation insofar as we reached out to those vendors that we currently worked with, those vendors that we had trials set up with, and we asked if they could make their trials available statewide. They all agreed to. Additionally, we had 1 or more vendors come to us and say, we want to make additional resources available. I know EBSCO was one of those. So ultimately, we were able to add 31 additional resources. Now, a lot of these resources were only going to be available for like a month, but then they extended them to 2 months, and in some cases, 3 months or more. Over time, it became apparent that there were some special needs. Now, I don't know about you, but when we all started using Zoom for meetings and virtual learning, did you notice little gremlins running around in the background? Oh yeah, the kids are home too, whether they're grade school kids, pre-K, whoever. So I thought, let's provide some more resources for children. And it just so happened that one of the vendors we were working with has resources for kids. It's a product called Pebble Go. We already had a couple modules. It's loved by kids and educators as well. So we were able to extend those trials statewide. Also, as many of you know, over time, our institutions didn't require the SAT, the ACT, as they normally do. But what I was hearing from colleagues at the Alabama State Department of Education was high school students about to graduate still need test prep materials. So fortunately, we were looking at a product from EBSCO called Prep Step. They made their product available statewide. Also, as we were into this for a few weeks, it became apparent it's hard to replicate some things in the virtual environment. For example, how do you create a lab setting? Well, it just so happened that one of the products that we were looking at is a 3D human anatomy resource of visible body. And at this time, I'm going to let my colleague and friend, Deanne, tell you more about it.
Great, thank you, Ron. Next slide, please. So good afternoon, I'm Deanne Campagnes, and I'm the Regional Manager for Wolters Kluwer Ovid. I represent Alabama, Florida, South Carolina, and the Caribbean. I've been with Wolters Kluwer for 15 years. This is my 10th Charleston conference and my first time presenting. We are so excited about our relationship and partnership with AVL. Knowledge of the body systems and how they interact with one another is important because it builds and promotes health and well-being. Finding high quality, unbiased, authoritative anatomy content can be a challenge. All visible body content is created by medical visualization experts. They actually go to medical school. And the content is reviewed by professors and healthcare professionals. Next slide. So during our discussions with Ron, Phill, and the AVL committee, it became evident that there was a wide audience for this product. So who would use visible body? Students that need to study anatomy and physiology images and then test their knowledge, parents that are homeschooling and need access to an anatomy database, patrons in a public library, could be family members, caregivers, diagnosed with a medical condition and want to review the location of the condition, surrounding structures, organs, and pathologies. Consumers who have health and wellness questions or sports-related questions and often need to refer to an anatomy resource to fully understand an explanation that involves a structure and a system. Flat pictures in a print resource are limited in showing how muscles, bones, and body systems work. And of course, today, clinicians providing telehealth and telemedicine support, they need visual support to show their patients a location of an issue or explain a diagnosis. Healthcare providers, home healthcare aides, nursing home clinicians and staff, rural hospitals clinicians and staff, medical and dental assistants, Department of Health employees, PT and OT therapists, chiropractors, medical consultants, insurance companies that work with medical claims, and even researchers at law offices that work on medical cases. The list just goes on and on. Next slide, please. And the other great thing about this product is that it's available 24/7. It offers apps for the Android and Apple devices. And by using these apps, your device can now activate augmented reality. Next slide, please. So augmented reality and visible body actually creates a learning experience that enables users to visualize gross anatomy and microanatomy as they would in a lab room with cadavers or specimens. The apps allow a user to place a virtual human organ or complete human body on a flat surface and use their devices as a viewing window to identify and virtually dissect the anatomy. In addition, there are a bunch of educational resources available, including lab manuals, activities, blogs, ebooks, etc. Next slide. And then when you download this PowerPoint presentation, if you click on this slide, it will show a short video and overview of Visible Body Human Anatomy Atlas. Next slide. Thank you. My contact information, and now I'm going to toss it over to Phill.
Hey, good afternoon. My name is Phill Johnson. I'm Dean of the Library at Auburn University, Montgomery. And what I'm going to talk about today are some of the challenges that we faced when we were trying to make all of these different resources available. So the first challenge we faced was simply making them available on the Alabama Virtual Library website. Now, we already had databases with some of these vendors, so working with them was really easy. The challenge was mostly with the vendors that we had not worked with before, which meant that we kind of had to educate them on how the AVL site works. So one of the first things we had to do was talk to them about the AVL has two methods of authentication. So one, you have a user authentication, and then the other is you have vendor authentication. So vendor authentication is via embedded URLs or URL authentication. So some vendors very familiar with that. So took, no time to work with them, some not so much, and it took some work to get through that process. Again, some of the vendors really easy to work with because they already understood how the AVL website operated. For instance, one vendor that we worked with in the past, which is Infobase, they added access to 16 additional databases, and all they did was add them to the landing page we already had access to. So all we had to do was advertise, basically. Another challenge that we faced in trying to make these additional resources available to 4.9 million Alabamians is access. So like, when everyone else around the country, when the pandemic hit, most of our students went home. However, they still needed access to be able to perform their coursework, right? So now for most university and college students, that they can typically log into their university or college portal and they're going to have access to that. But otherwise, we had to provide temporary access so that our students who didn't have full accounts already could go ahead and complete their coursework and have access to our materials on the AVL website. So again, for most colleges and universities, this was, they were in pretty good shape when it came to access, but for our other students, they were not so fortunate for many of them. But fortunately, when it came to the AVL, we'd already began working to improve access for users. And the reason we were already working on that at the time involved instances where we had people with a mobile device, usually on a carrier network, that wasn't within our state IP ranges. So in those instances, they're unable to authenticate. Now, this actually happens a lot along state borders, where someone living in Alabama might have a Georgia or a Tennessee or a Mississippi or a Florida cellular carrier. So our partner, the Alabama Supercomputer Authority, had already been looking at using something similar to API calling to determine where a user is physically located. Now, API calling is actually pretty simple to understand if we use a real world example. So let's say you go online to order a pizza from Domino's with your phone. So their website uses an API call to MapQuest so they can log your location. And that's how Domino's determines which location you are closest to. So basically what an API call does is simply logs your latitude and longitude. So the Alabama Supercomputer Authority had already been coding something very similar that it too logs a user's latitude and longitude. They call it physical device location technology. Basically, all it does is it checks to see if the user is physically located in Alabama. If they are, the AVL authenticates them. Really simple. Another aspect of that access that we had to deal with involved those users who were unable to set up with an account originally because they could not be geo-IP authenticated. Normally, these people would go down to their local library, be it public or school. They'd set up an AVL account, they're good to go. But again, the pandemic, shuttered our libraries. And so in cases like that, we have temporary credentials available to enable access. So in these cases, we would send these people to the AVL help desk. So really when libraries and schools shut down, the AVL help desk was a main lifeline that kind of saved the day for those people and allowed them to get credentials to be able to use the AVL site. Third challenge that we came up against is a longstanding one, and that's a digital divide. In terms of poverty, Alabama was ranked the 5th poorest state, again in 2020. So that means we've got a lot of families across our state that really just don't have the money to be able to afford internet access. However, thanks to a project funded by the state legislature, the Alabama Supercomputer Authority had been working to set up Wi-Fi hotspots at rural libraries throughout the state. We really have to remember when it comes to the digital divide, people are limited by what they can afford. If I have a student in one of my classes who can only afford a phone with 1 gig of access a month, that student's not going to have the resource or the access that they need to succeed in school. Now, I think the next slide, Ron and I are gonna kind of talk about some of the takeaways that we encountered in this process. Ron, you want to talk about those?
Sure. I think one of the takeaways is the importance of having good rapport with your business partners. Think of them, I still refer to them as vendors from time to time, but think of them as your business partners because they're providing something to you just as you're providing funds to them. They may ask you to do something. In return, you can ask them to do something. I shared examples of how we have had previous situations where we went to the vendors and we got complimentary access to a number of resources for extended periods of time. Don't be shy, just speak up. What's the most they can do? Say no? Early on, we asked for stats. And at the close of these trials, we were really glad we did, because some resources that we thought would get a lot of use didn't. Others got tremendous use. So it's important to have stats, even though we might not buy something now, like we're buying visible body or have bought visible body. We may buy something down the road if additional funds become available. And think of it from the end user's perspective. They get free access to this resource, which maybe somebody else will buy. So those are a couple of the takeaways. Also, another takeaway is we got patron comments. We put a form on the website to get patron comments, and those were real useful as well. Phill, what are some of the takeaways that you recall?
Yeah, I want to talk about the temporary database feedback form that we use to solicit user input about all these free resources. Alabama Supercomputer Authority put that together for us. It was great. We collected a lot of different information. What was the resource? Who was the target audience? Who was the person providing feedback? Were they a K-12 librarian, a university librarian, public librarian? Thoughts about the resource itself. Whether it was current enough, would it be a good addition to the AVL site? And then we also had a free form comments section on it, which this really kind of struck a chord with our users, and we got a lot of great information from them. Ron mentioned statistics, and let me just say, I know you're all going to be real surprised when I say that some of the numbers were suspect. We weren't sure that we were getting really good full figures about the usage. So, sometimes we all know stats are, can be good and bad. Access, I talked a lot about access. Another great takeaway is that we really expected to see a huge increase in AVL traffic when students went home in mid-March. And while we did, we didn't see the numbers we really thought we were going to. So anecdotally, we heard from people, students, family members, and teachers who said they had cut back on the amount of work that they required of the students, and thus they weren't needing to use our resources as much. So that was something that we really had not thought about at the time. Replication, Ron's already talked about working with our vendor partners. You can replicate this if you have those good working relationships with your business partners. Providing 31 free resources within a few weeks to 4.9 million people was a pretty big task, but working together, we made it happen.
Well, I want to add one more to that list, and that is have a marketing plan in the hopper. Have something you can fall back on in a situation like this, where you've got to quickly get the word out about these additional resources.
And Ron, you may want to speak to this. We have someone who's asked about, they're wondering about the long-term viability of these kind of short-term trials by publishers. Are publishers willing to work with libraries to get long-term affordable access to these educational materials? What do you think about that?
I think it all depends on the environment and the contacts at the business that you're working with. It may be possible to set up short trials for a large audience. Basically reach out to your business partners and just ask. Now, I think it's a very different story when you've got a major employer that closes, and that impacts thousands of people in the community. And that was another example of where we made just-in-time resources for our citizens. So I think there's probably a greater chance of getting additional resources if there's a real need, an emergency, but vendors may help you because it's free advertising for them. Maybe your virtual library won't purchase it, but maybe a school will, etc. So don't be afraid to ask.
Yeah, thanks for that question, Iris. I have to agree. Every time I put up a free trial for my faculty and staff and students, I get a lot of pressure to go ahead and get it. And many times I can't afford it. And so that is a real struggle. So any other
Thank you for the question. Thank you for the question too. And from the publisher perspective, it's definitely something that we are aware of, and we are just trying to remain open with our communication with all of our partners to explore as many new ideas and opportunities as we can to support in these current challenges.
And I concur with Danielle. The truth is that people originally thought this free access would only last for a very short period of time. And as it turned out, that was really inaccurate. And we had access far longer than we had hoped for. And that kind of goes back to, you know, those good working relationships with our vendor partners. And so, again, we were thrilled to have that access as long as we did, as many of the people within our state were as well. And as a result, we got visible body thanks to a good relationship with our partners. So, yeah. Any other questions?
There's one from, let's see here. I believe we will see new business models come from publishers, but what is key is keeping the lines open and reach out. We know these things are trying times. And someone else said Charleston helps.
Phill, why don't you and I speak on behalf of our institutions and academic libraries, and then let's let our colleagues speak from the perspective of their businesses. What I'm hearing, not only from academic librarians, but also setting through sessions this morning, is we're looking at a lot of cuts coming down the road, if not already. So we need the support of our business partners, knowing that we may not be able to afford their products in the future. So the hope is that they will make the resources, if not more affordable, then more available in maybe different formats.
Yeah, it's going to be a tough couple of years. And I think everyone's, you know, nobody's looking forward to that, that's for sure. But I think everyone's already having those conversations, you know, with our vendor partners. I'll let Danielle and Deanne speak to that.
There we go. It's always tricky unmuting yourself.
Yes.
Go ahead, Deanne.
Go ahead.
I was just going to share that I think that the key for me, I feel like, is that the more information that I'm able to get from the libraries and the librarians and from what's going on campus, that we're able to really have different types of conversations and drive those ideas and see how we can evolve from what we're doing. Because I think everyone is in a place of where we're looking at evolution and how we can really move forward to manage these challenges and stay ahead. So.
And I do agree with you as well, Danielle. I mean, we came together as a company to provide whatever support possible to our customers, and even folks that were not our customers, to provide information for all of this distance learning and remote learning. And especially when it came to medical, nursing, anatomy, and so forth, which is our specialty, it really was a plus. And, you know, I'm proud to represent a company that too was able to, you know, come out there and help our customers. And as Ron said, we're all friends and business partners out there, and we needed to come together. And I think it's been a great effort and a very rewarding experience.
Yes, it has. Thank you. And I think that it'll be interesting to see kind of where we all go from here. And so I'll be curious to continue these conversations and to see how it'll be interesting to kind of look back and say, we made it through that, right?
Yes. Agreed.
Amen to that.
I think that's all. Do we have any more questions?
Quiet bunch today.
I guess so. All right. Well, then, please don't hesitate to reach out to any of the panelists via the conference platform or through our contact information shared in the presentation. Thank you all for joining us today.
Yeah,
Yes,
thanks.
thank
everybody.
you.
Thanks, everyone.
Appreciate it.